Welcome to Chapter 14, the digestive system. I'm going to give just a high-level overview of this section, as you do get a lot of detail in your textbook, but there is some important information that I wanted to kind of highlight and make sure that you know for when you're looking to select your CPT code through the code book. So the digestive system is very complex, and it begins with the mouth and ends with the anus. The CPT code range is the 40490 to 49999. And this section of CPT codes has had many changes incorporated for new technologies and procedures and descriptions. And those descriptions have been This all has been updated to better align with the ICD-10-CM code set. In the CPT codebook, the codes are first found by body part and then by the procedure. And the subsection of the digestive system includes procedures involving system organs and are reported for open, endoscopic and laparoscopic procedures. But these are just some of the digestive subsections that you will find in your book. Just to note, the medicine section of the CPT codebook does house a section for gastroenterology and are classified as diagnostic tests. One of the tests is an esophageal motility study, which is a procedure for determining how the muscles of the esophagus and the sphincter valve work by measuring pressures. And they will use this study to evaluate for GERD, gastroesophageal reflux disease. Another code you may find in the medicine section under this is for an esophageal pH monitoring, which is a test that measures how often the stomach acid enters the esophagus, that tube that leads from the mouth to the stomach. So a little bit of anatomy and physiology there. Now, procedures of the esophagus are reported with 43020 to 43499 code range and are performed by incision, excision, endoscopy, that's just to name a few. The first step in determining the selection of the correct code is know the approach. For example, in the diagram you see cervical approach and thoracic approach here. And then just to note also, there are many codes in this section that include conscious sedation as part of the CPT code. So you'll see a lot of codes in this section with that conscious sedation symbol, so make sure to watch for that. And remember, if that conscious sedation symbol is next to a CPT code, which a lot of these codes in this section again are, the coder would not pick up an additional code for the conscious sedation. But if the coder, of course, is coding from this section, one of the CPT codes without this symbol, and they did use conscious sedation, then the coder would report an additional code for the conscious sedation. Just wanted to throw this one in here. Of course, there's many different techniques that are used for gastric bypass procedures, and there's a couple pictures there, and just pointed out a couple. Your textbook really does a good job of going into further detail about gastric bypass surgery, but just wanted to throw this in there for you. This next section is colonoscopy decision tree, which I'm going to stop, and because this one is, I'm going to spend some time on this slide. And each of these sections I'm only given 5 minutes, so I'm going to stop here and then pick up part 2, and we'll go through this colonoscopy decision tree that I want to highlight on.